Hello, my name is Jeffrey Shirley. I'm an advanced practice nurse at Piedmont Noonan Endocrinology in Noonan, Georgia. I am also a DNP student at the University of North Georgia. This presentation is about a DNP project being developed to improve the utilization of continuous glucose monitors, or CGMs, in clinical practice. The objectives of this presentation are to briefly discuss the impact of diabetes, to identify the benefits of CGM use, and discuss the DNP project. This includes the project purpose, evaluation plan, and data collection. I'm sure we are all aware of the devastating effects of diabetes. I'd like to briefly review the impact that diabetes can have on people with this disease. Diabetes has reached epidemic proportions. As of 2021, 38.4 million people in the U.S. had diabetes. This represents 11.6% of the entire population. Of these, 8.7 million people have diabetes and don't even know it. Diabetes itself was the eighth leading cause of death in the United States. The impact of diabetes on mortality is even larger than just being listed as the underlying cause of death. Individuals with diabetes have higher rates of cardiovascular and cerebrovascular disease, cancer, and renal disease. People with diabetes are twice as likely to have cardiovascular disease than those without, and diabetes is the leading cause of renal disease. Besides the physiological effects, diabetes can also lead to an overall decline in quality of life. Diabetes management is an extremely complex task. Changing diet, exercising regularly, working on weight loss, medication management, and glucose monitoring are just a few of the things that patients must do to keep their diabetes under control. The CDC has stated that regular blood sugar monitoring is the most important thing that someone with diabetes can do to manage their disease. Traditional glucose monitoring entails performing a painful finger stick and using a glucometer to obtain the one-time glucose level at the exact moment that the test was performed. Patients may only check their glucose once or twice a day, if that, and there is no data generated regarding glucose levels when the patients do not check their blood sugars. Continuous glucose monitors have now been developed that allow patients and providers to evaluate glucose readings throughout the day and night. They involve a sensor, generally worn from 10 to 15 days, and a receiver. A thin sensor is inserted into the subcutaneous tissue, and this measures glucose levels in the interstitial fluid every 5 to 10 seconds, continuously 24 hours a day. The data is then transmitted to a receiver, or a smartphone, that can be viewed by the patient and provider. Sensors allow patients to see how behavior impacts their glucose levels, including their individual responses to carbohydrate intake and exercise. They can help patients to identify and avoid critical hypoglycemic and hyperglycemic events. Sensors also help with improving medication adherence and mindfulness of their diabetes control. Knowledge of glucose levels is essential for providers to assist patients in managing their diabetes, as it helps them to identify what therapy adjustments may need to be made. It can assist the provider in making informed decisions on medication adjustments. Retrospective data can be reviewed to guide clinical decision making to ensure that the best therapies are in place to help patients improve their control. In addition, patients can link their data to the clinic. This allows a patient's glucose readings to be reviewed between visits, and timely therapy adjustments can be made without the patients having to wait for their next follow-up visit to implement changes to their plans of care. An extensive literature review was performed to determine the efficacy of CGMs in diabetes management. CGMs have been shown to be significantly more effective than the use of glucometer and finger sticks in improving glucose control. Multiple studies indicate that there is a statistically significant reduction in A1C with CGM use. There are an extensive number of studies that show significant reduction of A1C when sensors are used and improved clinical decision making by providers. There are also multiple studies that indicate an improvement in the quality of life for those using CGMs compared with traditional glucose monitoring. Multiple governing organizations include the use of CGMs in their practice guidelines. The American Association of Clinical Endocrinologists recommends the use of personal CGMs for people with diabetes to improve glucose control and reduce their risk of diabetes-related complications. This project will focus on improving the use of CGMs, a relatively new technology. The Technology Acceptance Model, or TAM, states that the perceived usefulness and perceived ease of use of any technology directly impacts its utilization in practice. This project will take place at the Piedmont Noonan Endocrinology Clinic in Noonan, Georgia. This is an endocrine specialty clinic and part of the vast Piedmont healthcare network. All endocrine disorders are treated at the clinic, but diabetes is the most common condition treated by far. On staff, there are 4 physicians and 3 advanced practice providers. There is also a 15-member clinical and office staff. Approximately 140 patient visits occur daily. The focus of the project is to improve the utilization of CGMs in clinical practice. The TAM has been shown to influence the use of technology, so the clinical question the project is hoping to answer is if the development of a new practice protocol may improve the perceived usefulness, or PU, and perceived ease of use, or PEOU, of continuous glucose monitors in clinical practice. The project has 4 goals. One is to increase the PU and PEOU of CGMs by clinical staff. This is the main outcome that will be measured, as TAM scores indicate the likelihood of use of a technology. In addition, the project is hoping to increase the identification of patients that are using CGMs, to streamline the download process for obtaining data, and to increase the number of patients that have linked their personal CGM accounts to the practice account. The intervention has 3 main components. The first is to develop and implement a new practice protocol on CGM use to be followed by the clinical and office staff. If we do not know a patient is using a CGM, we cannot use that data to improve a patient's plan of care. A process for identification of these patients will be developed. This should help to improve the perceived ease of use of obtaining CGM data for the office staff. Once a patient is identified, their data needs to be downloaded and entered into the patient's EMR. This can be a challenging process for the clinical staff, so the perceived ease of use of CGMs may be low. Occasionally, for a variety of reasons, the clinical staff simply does not even attempt to obtain the patient's CGM data. This may be because they do not fully understand the usefulness of CGMs in clinical practice. The last part of the intervention will be developing of education flyers, posters, and other media to encourage and assist patients in linking their accounts to the clinic. In addition to increasing the number of patients linked to the clinic, it is possible that the development of media and distribution may increase the awareness of CGMs for people that are not currently using the technology and encourage them to obtain a CGM for themselves. This aspect of the intervention can be a starting point for the next project. This is a graphic that represents the technology acceptance model. External variables impact the perceived usefulness and the perceived ease of use of a technology. This in turn impacts attitudes toward using a technology, impacts behavioral intention to use technology, and actual technology use. The evaluation of the project will occur using the TAM questionnaire. The TAM questionnaire was developed to assess the PU and PEOU of any technology. It consists of a 12-question survey using a Likert scale with 6 questions for PU and 6 questions for PEOU. Higher TAM scores are associated with increased technology use. The survey will be given pre-intervention and post-intervention. As a secondary measure, the number of individuals that have linked their account to the practice will also be determined. Just a note, when I discuss use of CGM for the staff, I am not specifically referring to them using the CGM themselves. I'm referring to the use of CGMs in clinical practice. Demographics will be collected, including gender, age, ethnicity, the highest level of education, and whether or not they are currently licensed, and what license they hold. This will allow for an in-depth analysis of the TAM questionnaire results before and after the intervention. The number of patients with linked CGM accounts before and after the intervention will also be measured. Data analysis on the TAM scores will be performed using a t-test. All data will be de-identified. The survey will be developed and administered to participants using SurveyMonkey. This will deliver the questionnaire to the patients and store the data. All data will be stored on SurveyMonkey's secured servers. CGMs have a great potential to improve the clinical outcomes and quality of life for individuals living with diabetes. Improving the utilization of CGMs in clinical practice will hopefully ensure that patients have the most appropriate plans of care and will achieve the best possible clinical outcomes. This concludes my presentation. Thank you for your time.